Dronabinol Solution is a medication used to help with nausea and vomiting caused by chemotherapy. It can also be used for people with HIV who have a loss of appetite and weight loss. Dronabinol is a man-made form of a natural substance found in marijuana. It is typically used when other medications for nausea and vomiting are not effective. The dosage and timing for taking Dronabinol Solution should be determined by a doctor based on individual needs. Before taking Dronabinol Solution, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist for clarification. Take this medication by mouth as directed by your doctor. If you are taking it to control nausea and vomiting, you may need to take it up to 4 to 6 times daily. If you are taking it to treat loss of appetite, you will likely take it twice daily, 1 hour before lunch and 1 hour before dinner. Drink a full glass of water right after taking each dose. Use a special measuring device/spoon to carefully measure the dose, and do not use a household spoon. The dosage will depend on your medical condition and response to treatment. Your doctor may also consider your body size when determining the dosage for controlling nausea and vomiting. It's important not to increase your dose or use this medication more often or for longer than prescribed. Doing so can increase your risk of serious side effects and will not improve your condition any faster. If you need to stop using this medication, your doctor may lower your dose slowly to prevent withdrawal symptoms. Tell your doctor or pharmacist right away if you experience any withdrawal symptoms. While this medication can be helpful for many people, it may also have the potential for addiction. To lower the risk of addiction, it's important to take this medication exactly as prescribed. If you have any concerns about addiction, be sure to ask your doctor or pharmacist for more details. If your condition does not improve or gets worse, be sure to inform your doctor. As your body gets used to Dronabinol Solution, you may experience dizziness, drowsiness, confusion, feeling high, an exaggerated sense of well-being, lightheadedness, nausea, vomiting, or stomach/abdominal pain. If any of these effects persist or worsen, inform your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when getting up from a sitting or lying position. Keep in mind that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people taking this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as fainting, fast or pounding heartbeat, or changes in mental health like anxiety, nervousness, hallucinations, abnormal thoughts, or paranoia. Although it is rare, a very serious allergic reaction to this drug may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not mentioned here, reach out to your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, call your doctor for medical advice about side effects and report any side effects to Health Canada at 1-866-234-2345. Before taking Dronabinol Solution, it's important to inform your doctor if you have any allergies, especially to marijuana or alcohol. This medication can cause dizziness, drowsiness, and affect your judgment, so it's important to avoid driving or operating machinery until you know how it affects you. It's also important to discuss your medical history with your doctor, especially if you have a history of substance use disorder, heart disease, high blood pressure, mental/mood disorders, or seizures. Children and older adults may be more sensitive to the side effects of this medication, such as drowsiness and mental/mood changes. If you are pregnant or planning to become pregnant, it's important to discuss the risks and benefits of using Dronabinol Solution with your doctor. This medication can also pass into breast milk, so it's not recommended to breastfeed while using it. Always consult with your doctor before breastfeeding while using this medication. When taking Dronabinol Solution, it's important to be aware of potential interactions with other medications. For example, drugs that contain alcohol, like disulfiram and metronidazole, should not be taken within 2 weeks before, during, or 7 days after taking Dronabinol solution. This could lead to a variety of adverse reactions, including flushing, headache, breathing problems, nausea, and dizziness. It's crucial to consult your doctor or pharmacist for more details. Additionally, it's important to inform your doctor or pharmacist if you are taking any other medications that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If you have any concerns, be sure to ask your pharmacist about using these products safely. If someone has taken too much Dronabinol solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. Residents in the U.S. can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe drowsiness or dizziness, fast heartbeat, mental or mood changes, and seizures. It's crucial to get help right away if you or someone you know is experiencing these symptoms after taking Dronabinol solution. It is important to remember not to share your Dronabinol solution with others, as this is against the law. Make sure to keep it in a safe place to prevent theft, misuse, or abuse. Also, remember to keep all of your medical and lab appointments to monitor your progress. If you forget to take a dose of Dronabinol solution, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. After opening, it is important to store the Dronabinol solution in the refrigerator or at room temperature and discard any unused portion after 28 days. It should not be frozen or stored in the bathroom. Make sure to keep all medications away from children and pets. When it is expired or no longer needed, it should be properly discarded. It is important to consult your pharmacist or local waste disposal company for guidance on how to dispose of the medication. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.